So good morning again. My name is Mary Ann Clantenberg. I'm the Vice Chair of the Genesee County Legislature, and I'm filling in for our Chair, Rochelle Stein, today. This is our media town hall, which is the purpose to disseminate information regarding the COVID-19 pandemic. And I will introduce who's joining us today. Along with members of the press, we have Lynn Johnson, who's the Chair of the Orleans County Legislature. We have Paul Pettit, the Public Health Director for both counties. We have Dan Ireland, the President of the UMMC, and we have Matt Landers, our County Manager. So we're all committed to continuing the fight against COVID-19, and part of that is disseminating information, making vaccines available, testing, especially our expanded program in our schools now. So those are all mitigation standards. We continue to urge people to get the vaccine, get the booster, because we are 20 months into this pandemic. And as we're going to hear today, our numbers are nowhere near what we want them to be. So without further ado, I'm going to hand this over to Lynn Johnson for some remarks, and then we'll get the roundtable going. Thank you very much.
Thank you, Mary Ann. I'm here to thank our healthcare heroes, I call them, in both Genesee and Orleans counties. They have been working tirelessly to protect us from COVID-19 and from other health threats. They are public health department professionals who work around the clock, and there are contact tracers, they are our epidemiologists, our data analysts, our microbiologists, our lab technicians, our health communication experts. I see Nola's on the phone. And you all are so much more. You're giving us what we need to protect our families and our communities, working tirelessly, advising our schools, our businesses, and our communities, and protecting those that are at greatest risk. So I say from the bottom of my heart to my healthcare heroes, thank you for all the service that you've given both counties through these tough times. I've seen the sacrifices you have made, and you've made these sacrifices throughout this whole year. We're blessed to have such a relentless group of healthcare professionals to take care of us. We're doing such an awesome job against this COVID-19 fight, and also with promoting the vaccines. And all of us can't wait for this to be over. Me especially. Hang tight, and the light is coming at the end of the tunnel. And I believe the light is at the end of the tunnel because of the vaccine. So stay safe, stay strong. And again, I'm just here to tell you how much I appreciate your passion, your professionalness, and your service to our two counties. So thank you, Mary Ann.
Thank you, Lynn. I appreciate those comments, and I support what you said 100%. That we are in this pandemic, and we have seen our employees and our public health employees in particular rise to the occasion and continue to do so. So I thank you for those comments. Okay, Matt, we're going to move on to you, and you can get this discussion rolling. Thank you.
Thanks, Mary Ann and Lynn. I'm going to be brief. We're joined today by Dan and Paul, who are going to be providing a lot of the content and the updates that we're all looking forward to hearing. I'm very glad to have Dan on the call on a Zoom session. We've been doing this quite frequently the last year or so, and this is our first opportunity to have Dan, and I hope Dan becomes a regular visitor to these updates to give the perspective of the hospital, which is a critical asset in our community fighting the pandemic. Our residents get regular updates here in Genesee and Orleans County to the west and the east from the Buffalo and Rochester markets from watching the news, but a lot of times they don't get direct information from the county from these same media markets. So this is an opportunity for Paul and myself and for Dan to speak directly to the numbers that are impacting us here in Genesee County. I'm very thankful for those markets joining us today to help bring the perspective to our residents of our local numbers. Genesee County is committed to taking appropriate science-driven logical steps to combat the pandemic. We support regional solutions in fighting this pandemic. Some of the issues or some of the measures that we've taken recently and ongoing is we have an ongoing media campaign with our media consultant E3 Communications. There's a new regional media push and contract being put in place with the Finger Lakes rural counties that we are putting in place as we speak to have a targeted campaign towards harder to reach populations, harder to reach zip codes or under vaccinated zip codes, populations such as Native American, Amish, Mennonite. Again, the difficult to reach areas where we're trying to find more creative ways to attack and go after targeted media advertising towards them. We have been doing weekly testing ongoing that never stopped. We had a very robust testing clinic that was put in place early on in the pandemic at our fire training center. And even though we've scaled that back, we still offer a weekly testing option that is not full. So there's opportunities every week for people to test free here in Genesee County, along with our vaccination clinics and booster clinics. We have a regular weekly vaccination effort along with targeted vaccination efforts. In addition, here in Genesee County, we have taken some steps for our own workforce. We've required from the very beginning that for masking purposes for Genesee County workforce, previously it was if you were unvaccinated, you had to mask. We have recently changed that as it was reported in the media, so that all Genesee County employees are required to mask while working. That was the first step that we've recently taken. Previous to that, it was the just unvaccinated, and we had a documentation process put in place, so we had a pretty good idea of who was and wasn't masked or vaccinated here in Genesee County. But we've taken the next step forward here in Genesee County based on the case numbers, based on the potential for workplace spread, and in an effort to make our employees as safe as possible, we have put these measures in place so that all Genesee County employees now, regardless of vaccination status, are being masked up. We're monitoring it, watching the caseloads. And the next step, the next second phase of this process would be to have the public that enter Genesee County buildings also wear masks regardless of vaccination status. Currently, we require unvaccinated people that enter our buildings to be masked. The next step, as I just said, would be all visitors. In addition to that, we're looking at other mitigation efforts as the next phase of our workforce, and that would be through density reduction efforts and more telecommuting. So these are some of the steps, and I'm not going to go through all of them that we've taken here in Genesee County. Any additional measures beyond that that gets reported on the media sometimes is something that we look at here, as I said before, in a regional approach. We're not interested in having a patchwork of different measures throughout the state. So that we have weekly calls with our partners here in the Finger Lakes region, and any additional measures that would potentially be considered, we think is best to be done on a regional approach or a statewide approach. But we feel like the measures that we are taking are effective as they can be, and that they are driven by science and in consultation with public health. So those are quick updates here in Genesee County. I'm so glad to have so much media here from the west and the east to help provide our Genesee County residents with Genesee County and Orleans County information. And I'm going to turn this over next to Paul Pettit, who is our public health director, who is going to be able to speak and provide some of those very specific numbers here to Genesee and Orleans County residents on what's going on here at Genesee and Orleans County. Paul?
All right. Good morning, everybody. Thank you, Matt. Thank you, Mary Ann and Chairman Johnson, for your words. It is nice to be able to get together in this format and be able to share about what's going on locally in Genesee and Orleans County. We do have a lot of data out there, whether it's from the state, whether it's from the Finger Lakes region, and I will be sharing some of that as I go through. But ultimately, we do have our own local data, and we have our own local epidemiologists that are taking a look at trends and what's going on locally for us. So we do like this opportunity. We take about once a month to report out and have the opportunity to engage with our local and regional media. I do want to thank Dan for coming on this morning. You know, I have a great working relationship with Dan. We talk regularly, and it's nice to be able to come on and provide a snapshot of what's going on from the healthcare perspective, which again is a big concern of ours, you know, with our healthcare systems and bed capacity, and you know, just the impact that COVID is, you know, driving and causing with concerns around those issues. So I'm looking forward to his update also. But as I get going, as usual, those that have participated in these, I do want to just take a real quick second and make sure I send my thanks out, as was done by a few folks earlier, to my employees and the workers in the health departments for all that they're doing on a continual basis. We're obviously about 20 months in or so into this pandemic, and their tireless efforts are duly noted. And I echo the sentiments mentioned earlier that you know, we are where we are and able to case investigate, do the vaccine clinics, the testing clinics, due to the dedicated workforce that we have in both these counties. And I'm proud to work with them. And, you know, they continue to do a great job working in the background, working in the foreground, making sure our residents are as safe as they can be. I also just wanted to note, I do have a couple of my folks working in the background who will be putting stuff in the chat. So if you, you know, want links, if you're looking for different information, or if you want to ask questions as we work through these reports and updates, I do have some folks that will probably be answering those back. So we do have a live chat option going also. So feel free to take advantage of that as we move ahead. So as I said, we will be sharing some data here, but as we go, I just wanted to first start off by letting everybody know we are continuing to see very high activity in both Genesee and Orleans County. It has been steady, though, over the last probably 6 to 8 weeks. Our numbers have remained fairly level, but obviously not where we want to see them. They're much higher than we'd like to see. But there are a few indicators of why that may be, and we continue to see steady spread in the community and in congregate settings, as we've noticed over the last, again, 6 to 8 weeks. A few key points to note before I get into some data. You know, a lot of this, and we mentioned this last month, is related to seasonal shifts in behavior. This is our typical, you know, flu, bug, you know, cold season where we see a lot of respiratory illness. So seeing an increase this time of year is not unreasonable or something that we weren't expecting. We had talked about this in the fall. People have gone back indoors. A lot of our birthday parties and gatherings, they're now indoors versus outside like we had during the summer and warmer months. So that behavioral shift has led towards increased contact, increased spread in those different settings, especially when, you know, various mitigation strategies may not have been utilized, such as, you know, wearing masks or maintaining distances, those type of different strategies. So we have seen a lot of increase in spread just due to seasonal behavior shifts with people coming back indoors. The other thing to note is the majority of the spread that is occurring, according to our data locally here in Genesee and Orleans County, is really occurring in households, in social gathering settings. Again, just likening back to what I just mentioned about the behavior change, this is where we're seeing our spread. It's household contacts where you have one positive. Typically within 4 to 5 days, we have 4 to 5 to 6 positives, depending on how many folks are living in that household. You know, a lot of our secondary spread is from exposure at, you know, again, birthday parties, retirement gatherings, whatever it may be. We just had Thanksgiving. Again, we are expecting to see a bit of a bump, which we did. Again, families getting together, and, you know, that has led to some additional spread. So a lot of our spread is not necessarily, you know, from a social or intermittent type of exposure. It's from those social gatherings where there's prolonged contact indoors. We're also seeing an increase in folks reporting that they just thought it was a cold. You see a lot of people out. This is, again, the sniffle cough season, and a lot of the case investigations we do, people say, hey, you know, I just thought it was a cold. I didn't think I had COVID. I wasn't near anybody that I knew was positive, and we weren't sure why. You know, I'm not sure why I may have it, so I just thought it was the sniffles or a random cold. They go get tested, and it comes back positive. So a lot of the cases and different spread we're seeing is also related to people that are going out to work, to school in different settings, and are symptomatic, mild symptoms potentially, but they're not getting tested in the front end anyways, and that's resulting in potential spread because they were positive and now potentially exposing others. So again, one of our messages we've said from day one is if you're symptomatic, stay home. Don't go to work, don't go to school, stay home while you have the symptoms, get that test and verify. Regardless of COVID, we don't want to be spreading germs around regardless. So that message is not just a COVID message. That's obviously our annual flu and cold season message. If you are symptomatic with anything, get tested, stay home, isolate. Also, the majority of the cases continue to be in those that are unvaccinated. Again, our local data is showing that. I'm going to share some of those statistics in a second. We have seen an increase in breakthrough cases of the vaccinated, but the majority are still in the unvaccinated population. All right, so those are some quick highlights, and we can touch on those a little bit more as we go through, but running the lines that we do report out on regularly that are available on our website. So, we do update those throughout the week. Feel free to go on and grab that and, the information as needed. But ultimately in Genesee County, we are at 8,933 total positives. We currently have 250 active cases. 35 of those active cases are in the hospital. And we have 147 total deaths as captured by the New York State Department of Health data website. So that's typically how we report those out. Our positivity rate currently over the last 7 days, again, through the New York State COVID tracker is at 12.5% in Genesee County. Jumping over to Orleans, we're at 5,917 total positives since the start of the pandemic. Currently at 334 active cases with 13 of those in the hospital. We are at 97 total deaths according to the New York State Department of Health data, and our current 7-day positivity rate is at 12.2%. And the positivity rate, again, we've talked about in the past, but that does go obviously up or down, but anywhere where we're at 12% in both counties is a lot higher than we want to see it. But that has gone up to 15% and then down to 10% over the last few weeks. So that does vary, and it's obviously an indication of the amount of tests being done on a daily basis, along with obviously the positives of those tests. I want to talk about breakthrough cases a little bit. So this data I'm going to share here initially is covering back to August 1st. So we started tracking breakthrough cases both in Genesee and Orleans County back in August when we started seeing the Delta variant take hold around the country, and we knew it was starting to pop up here in the New York area. And we thought it would be important to kind of, again, get that local data of, how many breakthrough cases we're getting. Again, this is those that are fully vaccinated with either 2 doses of Moderna or Pfizer or the single dose of Johnson & Johnson. So of the 3,631 cases since August 1st in Genesee County, there are 1,087 individuals who were fully vaccinated, 2,544 who were not or unknown status. So in Genesee County since August 1st, we have a 30% breakthrough case for those fully vaccinated. Orleans County, 2,814 new positive cases since August 1st, 805 fully vaccinated, 2,009 unvaccinated or unknown status, so 29% breakthrough case. So again, very consistent from county to county when we look at breakthrough cases. One thing to note, again, our data is showing as we look at these more month by month instead of that total cumulative view, our breakthrough cases have been increasing over the last couple months. Again, that average percentage, but basically in the last month since November 8th to December 8th, in Genesee County, our breakthrough rate's up at about 33%, so about 3% higher, and in Orleans County, 31%. So again, up a couple percentage points higher. A couple reasons for that. I mean, number one, we have more folks getting vaccinated, so they're potentially more eligible breakthrough cases. In addition, again, the vaccine over time with the Delta variant particularly, we know we need that booster shot in order to get the protection back up. A lot of folks that received the vaccine back in obviously late December, January, February, March are all eligible now at that 6-month point to get the booster shot. And a lot of the breakthrough cases we are seeing are actually folks who did receive that vaccine earlier. So we know that protection is waning a little bit, and obviously it precipitates the need and why we're really encouraging folks to go get that booster shot as soon as possible. Hospitalizations, as I mentioned, we have 35 right now in Genesee County, just a little bit into the details there. 31% of the current active hospitalizations for Genesee are vaccinated. And in Orleans County, of the 13, again, 31% are vaccinated. So it's the exact same amount. So these are folks, again, fully vaccinated who are unfortunately in the hospital right now with COVID. So we just want to share some of those statistics so people are getting an idea. One thing to note is, of those folks that are in the hospital that are fully vaccinated, none of them have received their booster shot or have gone through and completed, their booster series. So that is important to note, again, as we look at this data, that the booster shot is working in helping to protect people from getting the virus, and then also protecting and keeping them out of the hospital in reducing severity. So we're going to continue to track that data locally, but early on, again, we only have about a month's worth of data at this point, since the majority of booster shots, especially with Moderna, just started at the end of October. But ultimately, it is showing that booster shot is really helpful in preventing severity, which is why we're really encouraging folks to go out and get that, especially if you are at that 6-month or longer period for both Moderna and Pfizer, or 2 months for Johnson & Johnson. All right, so I want to move on from the data just a little bit. And again, we're happy to try to answer any questions as we go along on that. Touching on Omicron real quick. Again, it's very early. And again, we have the same similar data to what we're hearing on the national and state news on this. But ultimately, we know that it has been identified and isolated in New York State, along with many other states at this point in the U.S. And at this point, though, I do want to report we have not isolated it in Genesee or Orleans County. That does not mean that it is not here. It just means that it has not been detected. Very similar to early on, we had not identified Delta variant, for several months after it was more than likely here. So it takes a while to unfortunately get those strains identified. But more than likely it will be here at some point. We are still waiting and trying to learn more about this new variant. We do know that it may spread, most likely spreads more easily than the original COVID virus, very similar to how Delta spread a lot easier. Early indication is that, the severity does not seem to be too bad again, but it is early and they're continuing to track that. So again, we're staying on top of that and monitoring, but at the moment, we do expect that it will spread fairly easy, but hopefully the severity is not going to be too bad. But again, this is more important why we need folks who get the booster shot to make sure that they're as protected as possible. We do believe that the current vaccines will protect against illness from the Omicron virus and that variant. So we're, again, encouraging that you go out and get your shot as soon as you can, or get that booster shot. Also, along with other treatments that are out there for those with COVID, there is a belief currently, at least early on, that those treatments will remain effective in helping severity of disease. Okay, moving over to testing. Testing continues to be a bit of a barrier here in the rural areas for both Genesee and Orleans County. We're not unique here when it comes to that around the state with the rural areas. Again, we don't have as many access points as in the more urban counties, but we do have testing going on. There is limited testing being offered at both health departments. We continue to offer weekly testing clinics at both Genesee and Orleans County. Appointments are required. We do have a web registration site that we have on our website where folks can go sign up for that weekly testing. Our urgent cares, different health system touch points, and in addition to many of our pharmacies are also offering testing. So we'd encourage folks to go to the New York State testing site page. There's actually a website for that, and you can type in your zip code, your address, and it'll bring up any known testing locations. And that's really the best way we can refer folks to go and be able to find out where local testing options may be. We know it's a challenge. Everybody's requesting testing kits right now, whether it's for business mandate screening, whether it's for just people wanting to know, before they go out on vacation, if they're positive or host a party, whether it's schools, right, and mandated testing. There's a huge demand around the country. A lot of the different tests are on back order or not available currently. So it is going to become potentially more challenging, as it's strongly encouraged to get tested. Finding that is very difficult. So we would encourage people, again, to keep seeking that out. We're going to continue to provide testing through the county as long as we can, as long as we have, the resources to do that. But we do recognize it is becoming more and more challenging. Home testing and utilizing home test kits is becoming more and more of the process here as we move down the road with COVID. We do recognize that home testing is something that a lot of folks are starting to take advantage of. Again, you can go to pharmacies and buy these in different locations. We currently, in both Genesee and Orleans, as I speak at the moment, do not have a mechanism for recognizing home positive tests. We are in the process of developing a system where we'll be able to accept those, and then that would trigger a case investigation, just like if you went to a healthcare touch point and had a rapid test or a PCR test. So that is underway. We hope to have that available here by the end of this week or sometime next week. But at the moment, again, if folks are testing positive on a home test, we want them to obviously immediately isolate, don't go to school, don't go to work, any of those type of situations, and, notify your healthcare provider and or call the health department. And we will work with you from there in order to get the confirmatory test, and then obviously go through the case investigation like we normally would. If you just came to one of us in the first place besides the home test. But we do recognize that home testing is going to become more and more a vital player in this pandemic as we move along. So again, we will be releasing information on the process of reporting home testing here shortly. As we plug along. But again, if you do test positive on a home test, the best thing we can do is isolate immediately those test kits. If done properly, again, you're being trusted to follow these instructions and how it's applied, but ultimately they are very accurate if done properly. And a positive is a positive on those test kits. So again, we'd encourage you to get those and use them if available, if you have to purchase them, or you can find them in other locations. And then, obviously follow the basic protocol there that I just went through. One question we're hearing a lot of is, why we haven't heard from the health department. If you believe you've been a contact, so if you're a positive and, you're a friend of them and you say, hey, I had contact with that person, but no one's contacted me, whether it's through the school or through, a home contact, that can be somewhat challenging. So we are getting a lot of calls of why haven't I been called? Why haven't I been contacted about this or put on quarantine? There's a couple things for this. Number one, the positive may not have identified you as a close contact. So when we do our investigations, we go on what we're told, and what the positive is relaying to us as far as, who the contacts and who the positives were. So that is a trigger. Obviously, if you've been identified, then we would be reaching out to you and letting you know that you were in close contact of a positive and you would be put on quarantine. So sometimes there's a delay there. Sometimes when we do the investigation based on what we're told, again, we determine that you weren't a contact, even though, initially you thought you may have been. So there's a couple reasons there, but ultimately we do our best to identify who close contacts are, because obviously those are the ones we want to put on quarantine. And just in case they do become positive, we don't want to continue spread. But there is sometimes a delay there, and sometimes we just don't end up contacting you because you weren't identified either by the individual or by us through the investigation. Also, there could be a delay. We do work with the state heavily on case investigations, and ultimately with the caseload specifically right now, there's a backlog. So there may be a delay in you being contacted, whether it's through our staff or through the state tracers. A couple days potentially. So ultimately the best advice is if you believe you were a contact, or again, you have a positive test, stay home, isolate, wait for those contacts. And obviously we would continue forward with the investigation from there. One thing to also note, we do not communicate with your employers. If you are on quarantine or if you're positive, ultimately that's your responsibility as an employee, or whatever systems or process your employer has set up for dealing with folks on isolation and quarantine. Again, we don't make those contacts. We do provide you with your isolation and quarantine orders, and in addition to the release letters that you may receive once you get off isolation and quarantine, but ultimately that's your responsibility. On the school side, we do communicate directly with the schools for those folks on isolation and quarantine. So we have a dialogue so they know who's supposed to be out or not. So again, a little bit of patience there on those, as we do have high case numbers, but ultimately we are working folks through that process. The other thing, just real quick, is when we release folks from isolation and quarantine, we do send that letter, which is usually what folks need to go back to work, to potentially get paid for their leave credits, whatever it may be. I can't reiterate this enough. We need folks to answer the phone. We need folks to engage with us during the process, because if we're not able to do the investigation and we're not able to talk to you to release you, we can't send the letter. So we get a lot of folks calling us on day 10 or 11. I never got my letter, and we haven't been able to reach you, and we've called 4, 5, 6, 7 times. So the best thing I can reiterate here is if you want these type of letters and correspondence that you need, you have to communicate and do your best to engage in the process, because we can't and won't provide letters if we haven't done the investigation and we haven't been able to reach you to release you from isolation or quarantine. That's part of the process. So just an FYI there, I wanted to make sure that folks are aware again of that process on the front end, getting put on isolation and quarantine, and on the back end being released. All right, so just a bit on the vaccine update. Just again, we've talked about it over and over again, but we do know that our vaccines are our best defense. They're our best tool that we have in order to protect people from COVID, obviously protecting against severe illness and death. That's why we, again, are trying to get our vaccination rates up as high as we can. COVID vaccines significantly reduce the likelihood of hospitalization and death. Again, the best way to slow the spread of the virus. For people who are vaccinated and still get infected, again, the breakthrough infections we talked about earlier, there's still a risk of transmission to others, et cetera. We just need to, again, get that booster shot now and make sure we're protecting ourselves as best as we can. From a operational standpoint, both Genesee and Orleans counties continue to offer weekly COVID-19 vaccine clinics. We've been doing this since the vaccine was available, and we still have 1 day a week where we're vaccinating Wednesdays in Genesee and Thursdays in Orleans County. We do have a weekly schedule, et cetera, that we put out. We'd encourage people to go to our health department website. That, again, similar to testing, is how folks can sign up to get vaccinated. We have the full cadre of vaccine, whether you want Moderna, Pfizer, Johnson & Johnson, whether it's a third dose, booster shot, pediatric dose, we have them all. So you can go on and sign up for any one you may want, and we'll be able to take care of you. So we continue to plan on offering that on a minimum of a weekly basis. And again, vaccine is readily available throughout the community, whether it's at providers' offices, pharmacies are vaccinating. Again, the State Department of Health, refer back to their COVID page, has a vaccine locator similar to testing. We'd encourage anybody to go there and take that opportunity to search out local locations where they can get vaccinated. Now is the right time to do it. So take advantage of that. Go out and make your appointment for whatever you need, your initial or your booster shot. As far as some quick numbers on vaccine, again, real quick on the state side, New York State is at 79.4% of at least one dose, and that's out of the total population. 18 and older, they're at 91.8%. As we drill down a little bit, going down to the Finger Lakes counties, and again, from the Finger Lakes perspective, they capture 5 and older. That's their data point. Basically, anybody that's eligible for the vaccine, that's what they put their number against. And I would encourage folks to again, refer to the state data site or the Finger Lakes Hub, which contains Genesee and Orleans County local data. But ultimately in the Finger Lakes region, we are at 805,128 people with at least one dose, and that's 70.7% of the population in the Finger Lakes region. 718,102 have completed their series, or 63.1%. And 213,336 people have received a booster dose. So obviously we're getting more and more day by day with folks getting that booster dose, as again, we've shown that the importance of getting that as soon as you're eligible. As we drill down a little bit further, looking at Genesee County, we have 61.8% of the population with at least one dose, and 55.9% with the completed vaccine series. And again, if you go to the Finger Lakes page, it breaks down by age group. One thing to note, our newest, our pediatric level, 5 to 11-year-olds in Genesee County, we're at 10.6% vaccinated. Moving over to Orleans County, we're at 59.3% of the population with at least one dose, and 52% with the completed vaccine series. And again, looking at that 5 to 11-year-old category, we are at 9.5%. All right, so I talked about booster shots and the importance on that. Again, that is readily available. We want you to go get that as soon as possible. For homebound individuals in both Genesee and Orleans County, we do get calls on this. We are taking those requests internally. So if you are homebound and need, assistance in getting vaccinated, we want you to call our offices, and we're not going to get out there necessarily immediately per se, but we will put you on a list. And as our nurses, et cetera, have availability, they will go out and vaccinate in the homes as indicated. I just want you to make sure that there is a process for that. Feel free to call either the Genesee or Orleans County Health Department, and we will get you on that list. Just know it may take a little bit. If you are in a hurry to get that shot, we would encourage you to look through some other means potentially to get that. But we do recognize our homebound population and the needs and the importance to get them that booster shot or initial if they haven't done it yet. So we'll continue to assist there as able. All right. Want to jump over to guidance real quick. So real quick on the school side, as we've been doing throughout the entire pandemic, I continue to meet with all of our superintendents on a regular basis to discuss their needs at the school districts, testing, any other type of issues they may be having, obviously case investigations, cases, et cetera. I want to just reiterate again, our superintendents have done a great job. They continue to try to balance the needs of education, the health needs of, trying to deal with this pandemic. It's not easy. There's, a fine line there, and we're trying to really have a collective goal of keeping all of our kids in school, in-person learning. And, this year, I think we've done a fairly good job of that, in trying to reduce quarantines. Throughout the year so far. But obviously we want to do this while being safe, being healthy, and recognizing, the impact that COVID is having. So, with that, again, masking is still required at schools, indoors, per New York State and CDC guidance. So that continues. Again, that's not a local mandate. That is a statewide school guidance or school mandate that is imposed by the state. And all of our schools, again, are being consistent with that requirement. We are in the process of discussing some of the new strategies that are out there that have gotten in the news quite a bit lately around test to stay or TTS, test out of quarantine. These are things that we've been talking about in Genesee and Orleans County for the last month or so with the superintendents. We do have some challenges in the rural area to implement these. The state has been very clear with their guidelines on if you want to move forward with these, there's certain things that you have to do on the county level. So there is a checklist, and the schools have those, and we are discussing how we can implement, but ultimately they have to have a written plan around how they would implement these different approaches within their school system. And one of the biggest barriers is, it has to be done equitable. We can't have this just for some kids and not for others. All students within the district have to have the option and the capability and the access to participate, which obviously is very important, making sure that there's equity in education and learning. So we are trying to work through those, as I mentioned earlier, on the testing kit availability and capacity. That is one of the barriers. We are working on getting those. I will say at the moment, there would not be any participation in test to stay till after the holiday break coming up. There's not enough time to get anything implemented before that. So there will be more information coming out on that, assuming that the schools want to participate. Ultimately, once the county authorizes it, the schools will then have the flexibility to participate or not. Some school districts, due to the logistics and challenges, may not participate, some may. But ultimately, that is being discussed, and hopefully we'll have some answers here in the next couple of weeks. And then again, test out of quarantine is another option we're looking at, which again would potentially get kids back in school quicker, where they could test out of quarantine after 7 days, assuming they've had no symptoms and they have a negative molecular PCR test prior to going back to school. Again, just a bit on masks. Currently, both Genesee and Orleans County are categorized as high level of community transmission of COVID-19 per the CDC's guidelines. So we've been in that category for many months now. So no change in that designation, unfortunately. And with our numbers I shared earlier, I don't expect us to get out of that anytime soon. But ultimately, the CDC and, we are at the health department do recommend, obviously, masking, especially indoors in mixed settings, whether vaccinated or unvaccinated, per the CDC guidelines. But ultimately, there are no local mandates in Genesee or Orleans County mandating that in private businesses, et cetera. Many of these local businesses may have their own internal policy, or venues or events that you attend may have their own internal policies that require masks or screenings, et cetera. But those are put in place by those businesses. Those are not county mandates. So again, just wanted to touch on that real quick. I'm going to start wrapping up here just real quick on the holiday celebrations and general reminders. By working together, we can enjoy safe holidays, travel, protect our own health, as well as the health of our family and friends. This is a common message we've been talking about, but if you aren't vaccinated or haven't gotten your booster shot, again, now's the time. Talk with your primary healthcare provider if you have any questions. Again, we've said this from day one. If you have any concerns, questions about the vaccine, you're just hesitant, you're not sure, talk to your healthcare provider. We strongly encourage you to do that. Research, become informed. We want people to be educated and make informed decisions on their own health. So take the time to do that. Even if you don't have symptoms, consider testing prior to any gathering. We talked about this before Thanksgiving. We really recommended people go get those take-home test kits if they had them, or access to testing before you gather. I've heard many stories and heard from folks that did that prior to Thanksgiving, and they found out one of them was positive. So they obviously did not participate in the holiday gathering, where is if they didn't do that, they may have gone and obviously perpetuated the spread in that environment in their family and friends circle. So again, consider testing if you're going to be going to events or gathering for the holidays, for parties. Again, back to the message I mentioned earlier, if you're sick, experiencing symptoms, etc., isolate, stay home, get the test. Don't go to the party, don't go to the gathering. I know that's a hard thing sometimes, especially when you've been waiting so long for it, but the reality is, regardless of COVID, we don't want to be spreading germs and illness around. So stay home. Don't go to work, don't go to school, get the test. And let's verify and make sure you're not, COVID positive or spreading stuff around. Continue to follow our general public health precautions. Wash your hands frequently. Again, try to maintain social distance as able. Avoid crowds as much as you can. Again, wear that face mask, especially indoors. If you're going to be around folks, especially with unknown vaccination status. And again, with our breakthrough case rates at 30 to 33%. A third of our folks, even vaccinated, may be positive. So again, it just reinforces the need to have heightened precautions and make sure we're looking at these mitigation strategies. Last reminder, it is flu season, so I'm not going to miss an opportunity to remind you to go get your flu shot. We do have flu circulating in both Genesee and Orleans County. We do have positive cases, so we would encourage you to get the flu shot, just like go get your COVID shot. Let's protect yourselves, protect your family as best we can. And, let's try to, again, definitely not have our numbers go any higher, but let's work towards getting those numbers lower, lowering our positivity rate, and again, working together to get to that end. So I'm going to wrap it up there. Obviously, I'm here to answer questions after the end, but I know we're going to turn it over to Dan Ireland, who can provide some updates on the healthcare side of things. So it's all yours, Dan.
Thank you, Paul, and thank you, Mary Ann, Lynn, and Matt, and Paul for inviting me to join you all today, and thank you to our media partners for being here and hopefully helping us to get the message out to everybody about where we stand. Before I jump into the hospital report, I do want to do one more quick shout out to Paul and his team. They've been amazing. We've gone through a number of iterations in the last 20 plus months. And even most recently in making vaccine available on the fly for us and helping ensure that our healthcare providers are vaccinated, as well as supporting us with additional testing opportunities as needed. So Paul's team is really a true gem of our community, and I want to again shout out to his team, because they really make a difference in the work that we do as the hospital, and the clinic outreach here is well complemented with the health department's team. So thank you, Paul, and your team for all you do for us. So really, I just want to jump in. Let me just start by saying maintaining full access to healthcare in our community is Rochester Regional United Memorial's #1 priority. It's absolutely vital and essential. We know, and for many years have really strived to bring healthcare into the community and make sure that we could prevent people from traveling unnecessarily. And now during these times where COVID volumes have risen across the state and certainly in our region, it's vitally important for us to do that. But we can't do it alone. And I want to continue to echo some of Paul's messages our community really does need to help us by getting vaccinated, by wearing masks appropriately, and before gathering, get those tests. I'll give you my personal story. Before Thanksgiving, our whole family tested before we got together. And it felt at first as an unusual ask because we never had to do that before. But let me tell you, we were at ease when we were together. That we at least knew at one point there that we had tested and that nobody had tested positive. So really, it's a small step, but it makes a big difference, and it will help us in the hospital side because certainly as we continue to have a fair number of unvaccinated in the community, it makes a difference when they become positive, as we're seeing a higher percentage of unvaccinated patients in our hospital versus the vaccinated COVID patients. So, and I'll give you a few bits of information on that in just 1 second here. So we ask you to continue to practice that hygiene, and please make sure when you're visiting healthcare facilities, whether it's the inpatient facility or it's one of our outpatient centers, that you remember that we do require masks inside our facilities. We do promote high amounts of hand hygiene. There's plenty of foam hand spray around. Wash your hands frequently. Remember, we have a diverse amount of population coming in and out of the hospital because they have to, because they need healthcare services. And so, we want to minimize exposure across that. And so please help us with that step. So just from a health system standpoint across Rochester Regional, roughly just over 200 COVID positive cases in our hospitals around our region for Rochester Regional, 11% of those in Batavia, in our hospital here in Batavia. These additional cases compound an already steady high volume of patients that we have seen throughout this year. We believe a lot of what we were seeing was the product of people not getting health care for a significant period of time last year. And now we've been seeing, fairly high census all year long in our hospital of non-COVID cases initially. And now that's being compounded by, an increasing rate of COVID patients. In our ICU, we see about 62% of the patients in the ICU are COVID positive patients. And out of that, about 80% of those are unvaccinated patients. So to put it in non-statistical terms, the unvaccinated truly are showing signs of higher acuity in the hospital. So when we're admitting those folks, even though we do admit some vaccinated patients with breakthrough, as Paul alluded to, the sicker patients are the unvaccinated, with 100% of our ventilator patients right now being unvaccinated patients. So that's deeply concerning to me because we have, as the numbers show in our community, about 40% unvaccinated or just around that in Genesee and Orleans County. And, those are populations that are at a really, really high risk. And we really need the help in addressing that to see us through. We remain open for surgery, all types of surgery here. I know that's been reported in the media in the last few days because of some of the executive order actions. And so we've been able to run, at about between 85 and 90% capacity. So we are close to that number. And so it's always something we're looking at every day. But, fortunately for our community, we've been able to stay below it and be able to continue to offer those elective surgeries here. We'll continue to do that as long as it's appropriate. We do always have the option, if the volume continues to surge, to pull back on those even before the state asks us to. And we have had those discussions along the way, but at this time we've been able to navigate through this and make sure that we are able to provide safe care both in the surgery area as well as in our inpatient and ER areas. I do want to comment, volumes in our emergency room and urgent cares have been significantly higher. So if you are needing to seek care there, we just want you to recognize that the volumes are higher and therefore wait times are extended from what they normally have been traditionally here. but we have a very dedicated team of doctors and nurses and support staff working to get patients safely through as quickly as possible and get them on their way, or if necessary, admitted to the hospital here. So we continue to partner across our health system, and we continue to partner with hospitals around the region to work on any load balancing options that we can provide in order to make sure that all patients in our region get care, regardless of where you seek that care. On our outpatient settings, our outpatient clinics remain open. We have had to consolidate a few over the early fall area, not necessarily because of COVID, but more so just because of staffing and staffing changes. But we work to get all of them, reopened. For the most part, 95% of our clinics are open and accepting appointments. And those that are not, we have routed to other locations to provide care. So we anticipate to continue that going forward. We have not had to pull outside clinic staff formally into the hospital to care for our patients. We've been able to manage that with our inpatient team and other parts of our service lines. Really, I would just, in order to wrap up and make sure there's time for questions, I would again go back to saying thank you to our community for those and everything you've all done to support our healthcare workers, our hospital team. They've worked a lot of long and hours and days, and really have tried very hard to keep everyone safe and keep our doors open, and they've been very, very successful in that. I always say hats off to the team that I work with. We couldn't do it without our doctors and nurses and support staff who come to work every day in an effort to fight this battle against COVID. A fight I do believe someday we'll win, but we have to stack hands and do it together. So I thank you all for doing that with us. Again, Matt, Paul, Marianne, and Lynn, thank you again for inviting me. And as Paul said, I'll stand by for any questions that might come up.
Great. So if anyone has a question, we would just ask either you type it in, or if you want to unmute yourself and announce who you're with, and you get fire away the question to whoever you want to speak to. All right, look, Paul, looks like there's a question for you. Or I see a question that's sent to me. Any update as far as procuring in-home rapid testing kits in Genesee and Orleans counties in light of the Monroe County supply purchase?
Yep. So, well, we can both probably take a crack at it, but yeah, so there is discussion on a regional basis. We did not, as in we, Genesee Orleans, a lot of the other regional rural counties, did not receive some of the additional funds that Monroe County had received earlier on in this pandemic. Which they've been able to leverage to procure these test kits. We do believe that it's a great concept, and to have that available for our residents is something we definitely want to provide. So we are discussing again on a regional basis of the possibility of getting a cache that we could then have deployed throughout all of our counties and have again those access points so folks can go get those free take-home test kits. In addition to that, I mean, there is some movement also even on the federal level. I know President Biden is in the process of mandating insurances to reimburse for take-home test kits to insurances, et cetera. So even if you went and purchased one at a pharmacy, you'd be able to submit to your insurer for reimbursement on that. So essentially making it free in the end. So there are some things in process to try to reduce barriers and make test kits more readily available. Again, for things that I talked about and Dan talked about, testing before you get together in gatherings, different strategies to make sure you're not COVID positive, and going out and spreading that. So we are hoping to have that available to us, but right now we do not have those free test kits that we can offer, similar to what Monroe is doing, but that is in discussion, and hopefully we'll have some news on that soon.
Well said, Paul. All right, we have a question here from Tom Rivers. What kind of outreach will happen to encourage vaccinations as part of rural initiative? So the company we're looking to contract with, the Finger Lakes region counties that we're looking to contract. They've got multiple efforts that they're going to use. There's everything from direct advertising to postcards and targeted zip code mailings to specific areas to earned media initiatives. So they've got a multiple step approach trying to reach harder to reach individuals. You know, their targets are not necessarily trying to change the minds of people that are absolutely set, but it's really to educate, to go after vaccine hesitancy, and to go after some of the harder to reach populations, potentially, whether, I said before, whether it was Native Americans, potentially migrant workers, you know, targeted towards farms potentially. So there's a multi-approach, a step approach. One of the nice things is that they want to work with each county and look at some of the leaders in the counties to try to make the messaging as tailored as possible. So that it would hopefully be doctors from our region that would be communicating directly to our own people. So it's leaving out, it's the Finger Lakes, but leaving out Monroe County, because Monroe County has an entirely different messaging need with their more urban setting, and this would be more targeted towards rural. So we're excited for this opportunity. This approach region is hopefully the first of many approaches that the Finger Lakes region takes moving forward. As Paul said, we look at what Monroe County is doing with the test kits, and I personally fully support getting more test kits, home test kits into the hands of people, regardless of what their opinions and their beliefs are and what they're going to do with it. At the very least, if they test and they can take an action, that is wonderful. A positive action towards stopping the spread. It's a matter of trying to get these test kits. So we reached out to the state and asked if we could do something similar to what Monroe County is doing, but they are having their own challenges. The state is, as far as procuring enough test kits. So we are going to put our heads together and try to find alternative ways to do this. Tomorrow morning I'm meeting with several of these administrators, and I will be speaking directly about this. But I do approve and support the measure taken by Executive Bello, and I would like to see if more of us can do measures like that as far as procuring the test kits and making them available to people that want to take them. All right, last chance. Anything else? All right, before we wrap up, I just want to thank again Paul, Dan, excellent updates. Dan, I hope you're going to be a regular on these Zoom calls going forward. It's great to have the perspective. I didn't join in earlier, but I will say, thank Paul and his staff and Dan and your staff. You guys are doing a wonderful job fighting this in our community, unsung heroes, and all your staffs. And I'm very appreciative. And Marianne and Lynn, I was thankful as well to getting out here and helping spread the word and spread the message that we're doing everything that we can, but we understand there's more to be done. We aren't sitting on our hands. We understand there's a lot more that we're going to be having to do to fight this. While we've made great strides in this community, we still have to increase vaccination, increase boosters. People have to wear the masks, and I am all in for doing everything that I can to help support these initiatives. Marianne, anything else?
Yeah, thanks, Matt. Just to close, we've been in this pandemic for 20 months, but we're not anywhere near where we were when it started. We have tools now, and those tools can mitigate the spread and the severity of the disease. And what we need to do is convince people to use those tools, to get vaccinated, to stay home if you're sick, to get testing when you feel symptoms, especially those breakthrough cases, because you can have mild symptoms that mimic a cold and you don't know that you have COVID until you get tested. So if you're sick, you need to stay home until you can verify that it is not COVID-19. Otherwise, you're putting people at risk, especially those little ones. And, I have a deep heart for the little ones that haven't been in education for 40 years. Those little 5-year-olds and under cannot get a vaccine. And we heard from Paul that 90% of our students still aren't vaccinated. So we need to be mindful of, how we react to the situation and how it impacts those around us who don't have the chance to get that vaccine. So be mindful of our gatherings this year. If you're sick, please stay away. I think it's a great idea if you can get prior testing before a gathering. but that's not always going to be an option, especially if people don't have access to the kits. So, you know, take advantage of our public health department and their testing centers, because that's what they're there for. I want to thank everybody for being here today. Paul, Dan, Matt, Lynn, and all the media for your efforts. You're part of this, helping to get the message across, and we couldn't do it without you. A special thanks to the hospital staff again. What will we do without UMMC in our community? I mean, I think this pandemic has really brought home the need for small rural hospitals to exist. For a long time, that was in question. I think that question has been answered. We need that more than ever. I know there's countless lives that have been saved because of their presence in Genesee County, and I want to thank everyone for that. So in closing, I just want to wish everybody a Merry Christmas. Thank you for everything that you're doing and continue to do. And let's hope for a healthy, happy, safe New Year as well. So thank you again. Have a great day.
Thanks, Marianne.